And in
because
Canada, it requires a script. So you just can't go to the, Shoppers Drug Mart and just buy it off the shelf. DHEA has been around for a while and a lot of people go to it. And it's interesting over the years, some doctors are completely prescribing it at the fertility clinic. And now I see others that are not prescribing it as much. So let's do a deep dive and talk about this.
right. So people don't even know what DHEA is. They, in some circumstances, they're taking it because their doctor has prescribed it to them or their fertility specialist. DHEA is a prohormone. So it basically helps to produce other hormones in the pathway of hormone production. And it's naturally produced in the ovaries and testicles in men and the adrenal glands. And essentially, it helps the body produce estrogen and testosterone. And it has been shown to be a helpful fertility supplement to improve pregnancy rates for women with low ovary reserve. And it's interesting because a lot of women don't realize that they perhaps could test their DHEA levels on their blood, like taking a blood draw before they even initiate taking it, which I usually recommend before jumping on something, even if
Yes,
a woman has a
yes.
low ovary reserve, because what if they have high DHEA and they're taking it? We don't know really the mechanism. It's not a silver bullet. We don't really know the mechanism by which it's working or helping. We do see, though, that there have been in the research some studies that show that there's higher pregnancy rates and doubled, or higher follicular counts when doing IVF and taking DHEA. But I think it's a matter of not just doing, prescribing it in a cookie cutter way. It's important to kind of get a baseline. Like, so if your DHEA is off the charts and you're on it, you could get acne, you could feel irritable and restless. And who knows what it's doing, if it's even improving your egg quality if
No.
you're already high
Right,
on blood work. And in
right.
traditional Chinese medicine, it'd be like a yang dominant kind of picture, right? If
Yeah,
that's
so I'd love to add in. So thank you for bringing in the Chinese medicine piece because in DHEA, we look at it as a very yang, active, motivating, creating type of action, right? So if a woman comes in and they're already like overheated all the time and like we call them yin deficiency with heat, right? So in that case, we actually say it's not the best supplement for them. So can it harm? Well, I mean, technically, DHEA is not to be taken long term anyway. So, in the very short term, because listen, at the end of the day, when patients come in from the fertility clinic, they're taking whatever the doctor is prescribing them. So, I'm not there to say you need to stop, but I may say that it might not be as helpful as it can be unless you're someone like who's more yang deficient, you who's always cold and with that low ovarian reserve where it may help. And correct me if I'm wrong, Tanya, but DHEA, because it's a precursor to hormone production, sometimes it can go more estrogenic production and sometimes more testosterone production. So we don't exactly know which direction it's going to go for each individual. So it's a bit of a science experiment, right?
Yeah, it depends on the individual. And women with polycystic ovary syndrome have higher levels of DHEA naturally, which is kind of fascinating because, so I have polycystic ovary syndrome. If you've been listening to our podcast, you probably know that. And my reserve was very high when I tested my AMH. And back in when I was 30, it was 10 nanogram per mil, and that's a fraction of you multiply that by 7.14 to get the parts per mole per liter. So it's
Right.
like 70, right?
Which is through
Um,
the roof. Yeah.
yeah, which is through the roof. And my DHEA at the time was also off the charts high. So there's some connection between high DHEA and high ovary reserve. But then that high DHEA and testosterone that's found on blood work and that we know we have based on perhaps clinical symptoms like acne and hair growth on the chin or hair thinning on the head, that also reduces egg quality. So if you're dealing with a patient who has low reserve and then you're giving her DHEA, it's improving her counts, it seems. Now, whether or not that is improving pregnancy outcome, there was one trial that showed the pregnancy rate more than doubled. So they need more research on it, but it
Right.
is.
But you
quite
can't use it
outdated.
like blanket for sure.
No,
And again, in
no.
your case, it's like, well, if your DHEA is high, why would we give it to you? Like, no
Right,
way,
you
Jose.
definitely
Right. So that's
wouldn't give
a
it to a woman with polycystic ovary syndrome. And some people don't even know they have PCOS because there's
that's
no
right.
obvious, like, red flags. So, or perhaps they, they're having regular menstrual cycles, but they don't complain, or maybe they've just lasered their hair their whole life, on their face, and they had acne at one point, and there was a period where their cycles were irregular and they missed periods for a year, and now they're normal and regular. So you have to look back in the history in some cases, and they might show up as having a high ovary count, perhaps, but there's no diagnosis. So it's important that we do not use DHEA as a silver bullet treatment for sure.
And in Canada, it requires a script. So you just can't go to the, Shoppers Drug Mart and just buy it off the shelf. And so though, you're a prescribing naturopathic doctor. So you do have the ability to write a script for DHEA or not?
No. So we have the ability to prescribe thyroid, progesterone, estrogen, like my little new.
Yeah.
But no, so we don't have the prescribing rights for DHEA. If I did, I would prescribe it when it was indicated.
When it's indicated, yeah.
For example,
but it is hormone, yeah.
Yes, it is a hormone. So sorry, go ahead.
And the reason why I say this, and prior to COVID, people, when they go to the US, they read about it and they'll just go to the pharmacy and pick it up. And we don't know if it's good for them. They're taking a guess on their own. So we're saying, like, please, what we say, the disclaimer is this is not medical advice. Yet at the same time, it's like, let's be smart about it. And perhaps we don't just, like I said, trust Dr. Google, and just because you read that DHEA can do X, Y, and Z, it may not do that in your specific case. So really, it's like you need to go see your prescribing physician, and someone like Dr. Tanya, who's a naturopathic doctor who fully gets hormones and supplementation, and see if it's even right for you.
It is pretty exciting. I mean, that there is research showing that
yes,
there were higher follicle counts, more eggs retrieved, lower doses of medication required for IVF.
But we see that. Like, I mean, I don't know about you. Like, I've seen the difference.
100%. Yeah. So clinically, I see it. There is some studies. There is some research, but it's still variable. So I guess that's the biggest key. And then understanding, your own physiology and blood work, and kind of deciding rather than just jumping on it, for sure. Right. Like if someone comes in and their DHEA is on blood work is less than 2, and their ovary reserve is low, I would 100% go recommend it.
Yes.
In that kind of scenario, if their levels are like 6 to 10 and their reserve is low, might not be indicated. So it depends also what their symptoms are, or maybe they're going to go on a lower dose. Maybe we'd recommend a lower dose. So it's very individualized, but it is hopeful. It's very nice that there are things that can improve follicle counts, and that they're actually doing the research now. I bet you that eventually there's going to be a pharmaceutical company that manufactures a DHEA. And so,
for sure.
And then we'll, just like they do with progesterone, it's prometrium and bioidentical progesterone, right?
Yeah. Yeah. So basically, we're not saying yay or nay. Everything about this is like, it depends on your specific case. And so really, you just need to consult someone, have a team around you, so that you're not just taking things ad hoc, right?
And a big no if you have high DHEA, and a big no if you have PCOS. So it's like,
right.
Yes, figuring that out. Mm-hmm.
So for more about supplements, we did an episode on prenatals versus fertility supplements. So you can check that out as well. And we shall see you soon. If you have any questions, reach out to us directly at clinic@aliveholistichealth.ca, or find us on Instagram. You can contact Tanya or myself through myfertology. No, it's not a dot when it's like at myfertology on social media, and then also at Alive Holistic Health Clinic on social media.